My name is Dr. Tamiko MaGee Rodgers, and I serve as the Director of Recruitment and Strategic Initiatives with Global Alzheimer's Platform Foundation. We're so excited to have you all today at our conference, Inclusion with Intention, Centering Diversity in Neurodegenerative Disease and Research. I wanted just to take the time just to give everyone who are not familiar with the Global Alzheimer's Platform Foundation some background about our organization. It was started in 2016, and we are a patient-centric nonprofit organization. And what we are dedicated to speeding the delivery of innovative therapies to those living with Alzheimer's and Parkinson's disease by reducing the time and costs, right, of the diseases in clinical trials. In 2022, we launched our Inclusive Research Initiative, IRI program, to establish community relationships built on improving brain health, education, and access to health resources in underrepresented communities. And I had the privilege of leading an amazing team composed of community connectors, which you will hear from today. As you can see, we have our very own Mia Chester, who serves as the Associate Director of Diversity and Community Outreach and leads our team of community connectors. I'm excited that you will hear from them today, as some of our community connectors will serve as moderators for today's events. I want to acknowledge Mia, Paula, Janae, Justin, Diana, Michaela, and Adriana for their boots on the ground efforts and work in the work they do every day to ensure underrepresented populations are included in clinical trials. I wanted to also give you an overview of today's agenda. I know you all have access to Whova, but it also includes the agenda that we have planned for you all today. We can go to the next slide. Taylor? Yes, great, thank you. We're having our welcome, and then following, we will have a panel focusing on amplifying the participant voice, advocacy strategies for meaningful change. And then at the same time, concurrently, we will have another panel from grassroots to governance, strategies for effective policy advocacy, which will be hosted by Janae Austin Todd. Just note that these sessions will be going concurrently. So after we're done with this welcome, you will have to log out and then rejoin and through the agenda on the Whova app and join live stream for the following whichever panel you would like to join. And then we're going to have a Q&A sessions will also be a part of those panel discussions. And then at one, we're going to have a table talk one-to-one with Mia Chester. And that's going to actually feature Dr. Whitney Wharton. And then we're going to have another panel. They're going to be going concurrently, where we're going to look at enhancing representation in clinical research. And then another panel focused on enhancing representation in clinical research for site staff. The first one will be hosted by our very own Mia Chester, and I will also be hosting the one that's focused on clinical research for site staff and enhancing representation. Following that, we will have time for question and answer. And then following that, we're going to have another table talk hosted by our very own Chief Impact Officer, Lee Zisco, featuring, it's going to be Melissa Robinson. We had to, Councilwoman Melissa Robinson, we had to make some last minute changes to the schedule. And then we're going to have our first break, 2:10 to 2:30. And then we're going to actually convene back for two panels that are going to be running concurrently. One focused on building trust, creating community partnerships to enhance diversity in clinical trials, which will be hosted by Diana Basada. And then we're going to have a collaborative engagement, mobilizing community partners for inclusive research, clinical research. And these, again, panels will be going concurrently. And that will be hosted by Paula Atkinson. That will be followed by Q&A. And then we're very excited about our keynote, Dr. Goldie Smith-Bird. And that will occur at 3:15, 3:45. And that will be hosted by John Dwyer, our very own president. And then at 3:45 to 4 p.m., we're going to have a conference closeout. So it's a jam-packed, exciting conference. We're so excited about all of the discussions and dialogue that we will have today. We're excited that you haven't joined us. And I'm going to actually pass it over to our president, John Dwyer, who has some additional remarks for everyone. John?
Well, good morning or afternoon, or if you're in Europe, good evening. I'm John Dwyer. I'm the president of the Global Alzheimer's Platform. As Tamiko said, Our goal is to try to accelerate the discovery of therapies for Alzheimer's faster, more effectively, and at a lower cost for everyone, irrespective of race, color, sex, or creed. Much of that work has, in the last 5 years, centered on extraordinary focus on trying to make studies more available, broader footprint, make sure that people of a diverse racial, ethnic, and economic background are part of those studies to better reflect the actual occurrence of dementia and therefore have higher confidence that therapies are going to work in patients that get the disease from all walks of life. A quick story. It was 2020, 2019. I was in Kansas City, Missouri, and visiting a terrific leader there, Jasper Fuller, a physician who has been serving the Kansas City community, particularly through the Black Healthcare Coalition, for over 45 years. The sickest of the sick, the poorest of the poor, with dollars and nickels and dimes that he pulled together out of the community, in addition to federal and state aid, to make sure that he brought up the quality of care available to the men and women that relied on him and his colleagues in the Healthcare Coalition. I went to him and said, what can GAP do to help and frankly persuade you to participate in clinical trials? Because it's just dead wrong that we have such an represented number of folks from the Black community or the Latino community. And Dr. Fuller is not a man who minces words. And he said to me, yeah, you're a suit. And all you guys do is you show up when you need us, and you're never around when we need you. That is the biggest problem. He said, I believe in clinical research. We are not going to solve our problems without knowing what the next great medicines are going to be. But he said, not you guys, just, you're a one and done group. I said, no, we're not. He said, yes, you are, because you are all the same. So for the last nearly 6 years, actually it comes back to me, it was 2018, that we have been in Kansas City working with Dr. Fuller's group. We did not ask him to participate in a clinical trial for 2 years. We just said, what do you need, Dr. Fuller? How can we help? Lee Zisco sits on the board of the Black Healthcare Coalition, and we've made many relationships through that group. But the important point is, all of us on our side of research, we learned very quickly, owe it to the communities to give to them before we ask to get from them. And so that's one of the main reasons we started our first biomarker study, BioHermes 1. One of the main reasons we undertook forming the IRI program that Tamiko runs with Mia, and that program now has been running with a specific mission of getting into the communities, having our teams providing really important resources and access to resources that would allow them to inform their community, not just about clinical research, but about the Alzheimer's conditions, dementia issues, opportunities to change lifestyle, to improve health, as well as where the emerging science was. The team you're going to see today, I am very proud of, because what makes this team so different from many other conferences and projects like the one we're all working on today together is the GAP IRI team is every day in the field. They're at the grassroots. As many of our guests know, the difference between an armchair and a rickety old chair in a conference room is enormous. And if you're not with them and you're not living the same life they're living, you aren't going to be able to help them. And so I'm so proud of the people you're going to meet today, because while they're here today to moderate and spur interesting discussion, they do it from a strategic vision that is informed by the daily challenges of the African American, Latino, Asian American, and Native American experience. It changes everything. We say, what's the number one thing to get improve access and diversity is intentionality. Am I intentionally going to do what others will not do or don't do yet? So for all of you here today, we're thrilled to have you. I think the team has a terrific program put together. And I, more than any of you, am looking forward to it. And I give it now back to you, Tamiko.
Thank you, John. All right, so that concludes our welcome. You are more than welcome to join your next panel. Like I said, you would do it through the Hoover app and join the live stream to the panel that you are interested in attending. We want to make you aware that these are being recorded. So if you do miss out on a panel that you're like, oh, I really wanted to hear and listen, we will be sharing that with you all. So please, right now, if you can, just log out and log back into the panel you would love to join today. Thank you so much, and we'll see you all soon.